and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to talk about the flu, what it is and what it isn't, and also how you can avoid getting it and stay healthy. My guest is from the Health Department, Nancy Lemis. Welcome.
Thank you. Thank you for having me.
We talk about this frequently, and you know, sometimes people listen, but we want them to listen more.
Okay.
What is it about the flu that makes it more serious than a cold? Why is it a big deal? And it's a bigger deal for some people than others.
Right. People who have chronic health conditions such as asthma, diabetes, anything that really decreases their immune system, elderly, babies, they're the ones that have more complications from influenza. Influenza is a virus.
You know, it sounds more serious when you call it influenza than flu. Why is that?
Well, a lot of people call flu, they have different definitions for flu. Some people call flu stomach GI illnesses,
and that's
vomiting,
not.
diarrhea. It's not. When you have influenza, it's respiratory. It's usually more serious than a cold because you're usually feeling like you got hit by a truck. It comes on really sudden. You have cough. You have usually a high fever, not all the time, but most people do have a high fever. Your muscles, you're really sore. You just really can't get out of your own way. You have a really bad cough. And if you don't take care of yourself, it can develop into complications. Pneumonia, you may have to go into the hospital and get other medications. The thing with flu is, a lot of people don't realize is antibiotics are not going to help viruses.
Right.
So you can't run to the doctor and get an antibiotic and it's going to go away in a couple of days. It's going to take a little while for you to recover and get better.
There is, though, usually a prescription. So, I mean, you should check with your doctor because there's a prescription medication that can help shorten it.
Right.
It doesn't really
If you start having the symptoms, the most important thing is if you do start having flu symptoms, you need to go to your doctor right away because first of all, they need to do a test. And the most accurate test is they just take a little Q-tip, stick it in your nose, and do a nasal swab. And they can do it, tell you right away. It's an instant test. It's one of those rapid if you have influenza. And if you do, then if it's really early in the disease process, they'll recommend taking antivirals. Now, every year, depending on which strains are circulating in our community, is which antivirals are working with which virus. So it's very important that you follow up with your doctor as soon as you start the symptoms because that is going to help shorten the duration. And sometimes, and especially with elderly, it's going to help them not be as ill so that you may avoid that hospitalization.
Okay. But, I mean, that's why we don't want to get it in the first place. Is it can be very serious, especially for some people. And it spreads.
Yes, it does.
So even if we're not in one of those more vulnerable populations, if we are around people who are, our elderly parents, young children, you know, people who have compromised immune systems or asthma or things like that, we want to help protect them.
Right. And you want to always do your due diligence to cover your cough. You want to make sure if you are ill, stay home.
Yes, please.
Don't go and share your joy with everybody else. Make sure that you're putting your Kleenexes in the trash can, that you're using your protection. We teach the children, and you want to wash your hands.
Doorknobs and stuff.
Touch doorknobs after going to the bathroom, after sneezing, after using Kleenex, things like that. Always wash your hands. If you don't have soap and water, which is the best way to wash your hands, then do use your hand sanitizer. Keep it with you, especially during flu season. If you have to go to the emergency room with a family member or you yourself, say you sprain your foot, when there's outbreaks and things going on where we're seeing a really increase in flu in our area, if you go to the emergency room and people are coughing, don't go sit near them. Sit in the other part where there's not a lot of people.
Right.
And there are masks available at your doctor's office as well as in the emergency room that you can protect yourself. If you yourself are going because you do have a cough, please put a mask on when you go into the facility while you're waiting.
Right, and sit kind of off to the side.
Yes. So you want to protect other people. If you have young children, grandchildren, especially under 6 months old, those little fellas or little girls cannot get flu vaccine.
Right.
So you want to make sure that all the people around them protect themselves so that they're not giving into that vulnerable population.
Okay, but so the best way to protect yourself is to get the vaccine, is that?
Yes, it is.
And there's a lot of myths about the vaccine.
Yes, it is.
Some people think, will claim, oh no, it makes me sick, or oh no, it hurts.
Right. This year, we're recommending the injectable. We are no longer recommending for this flu season the mist, which we used in the past. They're recommending the injectable. It's the one that's working on the strains that are out there. They do testing, and every year the vaccine is different. So you have to get revaccinated every single year. Children who it's their first vaccine when they're babies, they have to get 2 doses. After they're 6 months old, they can get a vaccine, they get one, and then a month later they get their second dose. And then next year they only have to get 1. We do recommend that you try to get it before the end of October, but even it's now November, it's not too late to get it. It does take 2 weeks to become effective.
Now that's earlier than I thought. I thought, flu doesn't usually hit.
We're already seeing some.
That's what I've heard.
Yes, we're already seeing some from the doctors, and we get reports every day. I get them from any of the medical facilities that do testing. We get those results, and they're the rapid test to let us know what they're seeing. With the vaccine, the myths are you're not going to get sick from the vaccine itself.
And I will say personally, I never have, and I get one every year because I have asthma, and my doctors really encourage me to be careful. And I have never gotten sick.
No,
there's a little achiness sometimes at the injection site, but it goes away pretty quickly.
And I tell people, take some Tylenol, move your arm around a lot because it's going into your muscle. If you do become ill after taking your vaccine, it's probably because you were exposed to something prior to coming in.
Right.
Your vaccine does not take effect for 2 weeks. So even though you get your shot, say I got my shot today, I can't go around somebody tomorrow and expect to be covered, to be protected. So you need to make sure you give yourself those 2 weeks. And
which really means don't wait.
Right. Please don't wait.
Yeah,
but
just do it now.
Also remember that no vaccine is 100% effective. So even if you have the vaccine, it is still possible that you could get flu. But the good thing about it is it's going to keep you probably out of the hospital. It's going to keep you from dying. We do see normal, healthy people who don't have those high-risk situations pass away from flu. And as the epidemiologist, having to call somebody and interview a parent of a child who has passed away from flu, that is not one of our favorite things to do. And one of the questions we have to ask the parents is, did they receive a flu vaccine?
Oh geez, how guilty. Oh my gosh.
Yeah, it does. It does. It's not a great thing to do, but it's very important that you get your flu vaccine, get your children vaccinated. It's only going to hurt for a little while. Like I said, take some Tylenol, and in the next day or so, you will be back to normal, not even remembering that you got it.
It's a lot easier to get the vaccine now. Like, it is kind of everywhere.
It is.
Does it matter? Is it all the same if I go to a drugstore or my doctor or the health department?
It's all the same vaccine. There are some vaccines that elderly can take, which is a little bit, it's a little bit different from the regular flu that most of us take. But that is between you and your doctor whether they want to choose that. But either way, it's going to cover the same viruses that are out there. So it's very, very important. Go as soon as possible. Your drugstores have it. The health department has it. Your doctor's office has it. And most insurances cover it.
Yeah, well, I think that's probably also why it's so prevalent, is that insurance does cover preventive measures, and all those places will file for you. I mean, some of them give you gift certificates. There's a real community effort out there.
Right, because we want what's called herd immunity. The more people that get it will help protect the people that didn't get it. So
but I think that's why people think of it as not serious, too.
Yes.
Is because we don't have, the Spanish influenza anymore. We don't have those epidemics, and people don't remember It's not in our lifetime.
Well, we did have H1N1, so we did, and we've seen, not in the United States as much, but in other countries we've seen swine flu and things like that, which is not what we're seeing this year here in the United States. But you still want to protect yourself, because you never know if it's going to be, you know, a bad year for you. If you do get influenza and you do have complications, there is a possibility with those complications that you could die. So you want to make sure that you protect yourself.
Absolutely. Okay, anything else we need to add about, you know, it's not going outside in the cold that's going to give you...
No, it isn't. They're old wise tales, sitting outside on the cement, going outside, we're not wearing a hat, things like that. No, it's the germs themselves. It's the viruses that are out there that's going to make you sick. It's not the actual air outside that's going to make you sick. So just use your common sense, wash your hands, stay away from people who are ill, cover your cough, make sure that you are, you know, if you are ill, please stay home and don't go sharing the germs. If you are sick, please follow up with your physician, because if you can take the antivirals, please do so, because that will make you feel better a lot quicker, and you'll get back to your normal lifestyle. So, yes.
Okay, well, thank you very much.
You are welcome. Thank you.
And thank you for watching. I hope you will join me in getting vaccinated. Even if you don't think you're high risk, think about those you interact with and help protect them as well. Wash your hands and take care this flu season. Thanks for watching.